Every 9.5 minutes, someone in the United States is infected with HIV, the virus that causes AIDS. The disease is a serious public health concern, and June 27th was established as National HIV Testing Day. According to 2015 data, there are nearly 2,000 people living with the HIV virus or have AIDS in West Virginia. The Bureau for Public Health Office of Epidemiology and Prevention Services has a special group that actually hits the streets to help those at risk. They're called Disease Intervention Specialists. Take a look.
My name is Kenya Burton, and I'm a disease intervention specialist. Basically, what we do is we track down infectious disease, and we try and promote healthy lifestyles by having those patients tested and treated, as well as the patient's partners. So this is our OraQuick HIV test, and it basically will test for antibodies and oral fluid. There's no blood involved, and it only takes 20 minutes. We're going to go out in the community in a high commercial sex worker area and search for some particular patients that we have been trying to come in for treatment. So I may park across the street and sit for 15-20 minutes just to kind of do almost like a overview of the situation. So sometimes we're in high crime areas, and we have to knock on doors. Oftentimes you're met with anger, with frustration, but once we explain that we're specialists and we're only there to ensure their safety as well as the safety of the community, then oftentimes they will calm their behavior and listen and follow our recommendations. If we are able to get them linked to care, it stops the spread of disease. One of those aha, I'm actually helping public health moments was one of my HIV patients. Just filled me in on his life, and that, you know, he was glad that I was persistent, and that he was able to purchase an apartment and get his life together, and he was continuing with treatment, and those are those moments that let us know that we are truly making a difference.
Disease intervention specialists also help those at risk for syphilis, gonorrhea, and hepatitis. Joining me to talk more about the HIV/AIDS problem is Christine Teague, Director of the Ryan White Program at Charleston Area Medical Center. Christine, thank you for being here.
Thank you for asking me. It's a treat to be here with you.
You don't hear much more about HIV and AIDS like we used to. It was always top of mind awareness, and now, you know, it's not discussed as much. Let's talk about what a problem that it still is today.
Yeah. You know, it absolutely still is. It's not on people's radar as much anymore, primarily because we just don't have funding for prevention. But it's still a tremendous problem. Even 30 years into the epidemic, we still have the same number of people that test positive every year. What's changed is that the people that's affected by it, it's largely a problem now that we see in minority groups, African Americans in particular, both men and women, and in younger gay men, which is concerning. The other thing is that because we do have effective treatments now for HIV, people they live longer and productive long lifetimes, and so there are a lot more people that are living with HIV and AIDS in West Virginia and nationally, and it's costly to take care of those folks. The other issue is that as they live longer, they have more comorbidities such as substance abuse and behavioral health issues. And poverty, and that's what we see in West Virginia. And we're very, very concerned that, given our similarity to Scott County, Indiana, where they had an HIV outbreak last year due to their substance use problem, that we potentially could see something similar here in West Virginia at some point.
Now, I mean, certainly we all want to focus our attention on this problem that still exists in West Virginia today. You know, we want to eradicate, obviously, HIV and AIDS. What kind of steps do we need to take here in West Virginia?
Yeah, absolutely. There's actually quite a bit of buzz in the community and nationally about eradication. We think that we have the tools to do that. And it's all based on a national HIV/AIDS strategy that was developed in 2010. And it's geared at, there's two arms to it. One is treatment and the other is prevention. And in the treatment arm, what we want to do is we want to identify everyone who's HIV positive, hence the importance of testing, getting people identified into care, having them stay in care, getting them on medication so that their virus is suppressed. By doing that, they are much less likely to transmit to other people. And then the other arm is prevention, is identifying all people who are high risk and then getting them to embrace risk reduction, whether that be condom use, abstinence, or something called PrEP, or prevention, pre-exposure prophylaxis. And by targeting both of those groups and maximizing outcomes within each group, we think eventually the virus would eradicate itself, but we still have a long way to go in both of those categories.
Therefore, the need for your program.
That's
I know that you oversee the Ryan White program there at CAMC. Can you tell us a little bit about that particular program?
Absolutely. The Ryan White program is a national program. It was established in 1995. Last year we actually just celebrated our 25th anniversary. But it was established for Ryan White, who was a young hemophiliac who died and did a lot in terms of education of the public. And when he died, that's when Congress authorized the Ryan White Care Act. And it essentially establishes funds that go into various parts to make sure that every need of a person's outpatient care who, if they have HIV, irregardless if they're uninsured or underinsured, every aspect of their care is taken care of. And our program is considered a Part C program. There are two in West Virginia. The other is at WVU Morgantown. And we were first funded in 2002, so we're going on into our 14th year of being funded. And it's we are at CAMC, and it's an outpatient care program that, again, takes care of all the outpatient needs of those individuals. And we have right now about 400 people that we take care of. We've had a lot of people that have been in and out, and over the years there's probably been close to 1,500 people that we've taken care of at some point.
Sounds like, I mean, obviously you do some very important work and it's critical. And I know that you just recently were awarded from a grant from the Elton John AIDS Foundation. Wonderful. I mean, congratulations to you.
Thank you.
What does that allow you to do? What more can we do here in West Virginia?
When I talked about maximizing the treatment component of folks, we call that the care continuum. We want to get people in care, engaged in care, and stay in care. And with the Elton John grant, we hired a retention coordinator who's somebody that's able to work with folks, identify them if they're missing appointments. He can go out into the community, make home visits, and he is able to go to all of our 19 counties and do that, engage them, and also do home testing kits and give information on PrEP.
Well, you're doing some great work. I appreciate all that you're doing and that you'll
Thank you.
continue to do in the community, and you know we're here to support you. So
Well,
thank you
very
again.
much.
Thank you for being
Thank
here.
you very much.
Many children may be out of school for summer, but now is actually the best time to check your child's vaccination record. We'll tell you why when we come back.